So thank you for joining me. This is exciting. So we're going to be looking at the smoking addiction and also combining that with the emotional full MAT healing. So I really look forward to it. Thank you for volunteering. I really, really appreciate it. Thank you.
Thank you.
I'm very excited. This is going to be, just have a feeling it's going to be good.
Yes,
That's going to be good.
It's going to be
yes,
great.
Exactly. So now we already know that this demonstration is going to be about the addiction to smoke. So we now have the issue, we know what it is. So my question I just want to know kind of like, when did it start?
I started to smoke in young age, probably about 17, 18. Yeah.
Got it. And was there anything, and you don't have to tell me what it is, but was there anything in your life that was emotionally stressful or upsetting, or even that led up maybe to a year or so before you started?
I would say more like I felt quite lonely. Yeah.
Got it. Yeah. And so I remember you also said that you quit smoking.
Yes, 6 months ago.
Got it.
Yeah.
So, but then we had other addictions coming in to fulfill that smoking addiction. What was that?
Yes. Alcohol and food addiction.
Alcohol and food, got it. So when you quit the smoking, what was the emotional stress that you felt at that time that made you feel like you needed to reach out for the alcohol?
Overwhelmed.
What else? Perfect.
I felt lack of support.
Got it. What else?
It's like not being understood.
Got it. Loss of support makes perfect sense. When she quit smoking, feeling loss of support, because for women who smoke, it is to feel that feeling of support, masculine support. Women who smoke lack healthy masculine support. And also it could be that they've been too much in their femininity and they're trying to get back into their masculinity. It's also poor boundaries, smoking. Perfect. This is very helpful. So I'm just curious, did mom or dad smoke cigarettes maybe when you were growing up?
I don't remember them specifically smoking,
Okay.
but I know that my dad quit when I was born.
Oh.
Yeah. And my mother used to smoke prior to being pregnant with me as well, I believe.
But not during your pregnancy?
Not during, I don't think. As far as I know, to my knowledge. Yeah.
Okay, very good. That's great. That's very helpful. Thank you for that. So just apart from the loss of support, also when you did quit, what other emotions do you remember feeling, or even feeling now that you are aware of?
I'm feeling the loneliness deep in my heart. And, yeah.
Got it. Perfect. So now we look at follow the structure. Okay, we have the emotions. Got it. So she said already she felt the loneliness in her heart and the loss of support.
Yes, loss of support.
In the heart.
I feel it in my belly more than in my heart.
Got it. And this is just my notes that I'm making for myself. Got it. Do you feel the loneliness or loss of support somewhere outside of the body?
The loneliness outside and both of them inside and outside.
Oh, got it. Nice. This is one of those moments where I'm just dying to blurt out something, but I don't want to because I don't want. Okay, let's be playful. Let's pretend that this soul copies have voices or faces that you know or recognize.
So in the heart, it's my mom outside.
Yeah.
And in the stomach is my dad.
Nice. Got it. Very good. Got it. That's very helpful. Thank you for that. Thank you. So I would like to have this. Let's just be aware of that loneliness. Just be aware of that loss of support, the part that you feel inside of you, inside your body. And when you feel that loneliness and that loss of support, how does your physical body react? What are your instinctive responses that comes forward?
For loneliness, I have a surrender, flight.
Flight, like run away?
Yeah, run away. Hide.
Got it. Perfect.
And numbness as well.
Got it. Very good. Perfect. So tell me, in that time when you feel that sense of loneliness and that loss of support, what is the positive emotional need that you have? What do you need in that time of loneliness and loss of support? If there's one dominant positive need, what would it be?
Love. But it's tied up with connection as well.
So which one do you feel is most important to you? Which one does it feel most relevant to? Or is love connection to you?
I think
It
so.
depends on it.
Yeah, I think so. There's an association of love being the connection.
Got it. And do you feel the word love is the best one to use for you?
I think so, yeah.
Yeah? Okay,
Mhm.
perfect.
Yeah.
So because we're working with addictions, we're going to add another question here. So I'm just curious, when you smoked in the past or when you have the alcohol, what did the cigarettes or the alcohol give you in your life emotionally that you couldn't feel or access on your own? And take your time.
Comfort.
Got it. Perfect. That's perfect. Thank you for that. That was perfect.
Thank you.
Got it. And that makes perfect sense, right? Feeling lonely, loss of support, needing comfort as well. So this whole cycle comes full circle and locks in the addiction. Okay? You're doing great. Very good. So now what I would like to do is take a nice deep breath with me. And I would like you now just to feel, see, sense, or hear yourself in your favorite place. Or that you're like a caterpillar that's in a beautiful cocoon, and that cocoon can be any color of your choice. And as you are in that place and space, I invite you to also just have an awareness of the loneliness. Have an awareness of the loss of support. And have an awareness of the need for comfort. And be okay with these emotions being there. Be okay with it. And this is where I'm going to say, now I'm going to go quiet for 2 to 3 minutes. But now I'm going to do everything out loud to explain to you what I'm doing. Okay? And then I'll say the acknowledgements, of course, out loud. But I'll prompt you when we get there. Okay. So now, I'm starting with the emotions. Okay, I know where that is in the heart, loneliness, loss of support is in the stomach. Okay? Spa, relax. Okay? I'm just going to close my eyes. I'm connecting with her. My light's around her. Holding that strong, clear intention. We're really gently going to resolve and dissolve. Dissolve and dissolve. And I'm now in the body. I'm in the heart, in the gut. Not me in there, but that's where my focus and intention is. Okay? Gently resolve and dissolve. And I'm just going to go quiet for a few seconds to just be present with that. Also just addressing the limbic system, the snail. Resolve and dissolve. Spa place. Also just acknowledging the surrender instinct, the runaway instinct, the hide instinct, and numbness. Allowing that beautiful reptilian mind now to gently rebalance. Rebalance the surrender. Rebalance the runaway. Rebalance the hiding. And rebalance the numbness. And we acknowledge the difference between surrender and loneliness. We acknowledge the difference between surrender and losing support. Acknowledge the difference between the runaway instinct and loneliness. We acknowledge the difference between the runaway instinct and loss of support. We acknowledge the difference between the hiding instinct and loneliness. We acknowledge the difference between the hiding instinct and losing support. Acknowledge the difference between numbness and loneliness. And the difference between numbness and loss of support. We acknowledge the difference between the surrender instinct and the runaway instinct. And the difference between the surrender instinct and the hiding instinct. And the difference between surrender and numbness. Acknowledge the difference between the runaway instinct and hiding. Releasing that conflict between the instincts so that they can gently rebalance. And the difference between running away and numbness. Acknowledge the difference between the hide instinct and numbness. I'm just really gently going to connect now to the soul copy of Mom. It's at the heart area. So I'm just going to go to the tail, resolve, dissolve. I'm just going to go quiet for a few seconds and just be present with the process. Also going to acknowledge the soul copy of Dad. It's at the stomach area. I know that was a big one. You're doing great. You're doing great. Doing really well. Doing really well. So I'm just going to go quiet for 3 seconds. Again, the tail, copy. Now we're going to do the acknowledgements. We're also going to acknowledge the difference. Acknowledge the difference between needing love and feeling lonely. Also acknowledge the difference between needing love and feeling loss of support. We acknowledge the difference between needing comfort and smoking. Acknowledge the difference between needing comfort and alcohol. This is the extra step that we throw in for addictions. Also acknowledge the difference between your identity and your mother's loneliness. We acknowledge the difference between your identity and your father feeling loss of support. That's the soul copies. I'm just going to check in with her again. Just for a few more seconds. I'm just going to go quiet. I'm just checking the limbic system, reptilian mind, checking the body, heart, stomach. So I'm just going to go quiet for a few seconds and just be present with that. Also just acknowledging now that that part of you remembers and rediscovers her own worth and her own ability to love herself. To know and understand that your need for love can be fulfilled in the utmost, highest and best way, in a way that makes you feel safe, supported, and in control. To remember that it is your birthright to receive, and that you can receive in a way without having to pay a price for having your needs met. That you can now be supported in a way with discernment that allows you to feel safe and in control. And remembering how to ask for the kind of support that is in alignment with your needs in the highest and best way for you. I'd like to give them a few seconds just to digest it. Just a few seconds, just be with it. And only when you're ready, I invite you to come back to me. Welcome back.
Thank you.
Where did you get that necklace? It looks like something that you would get in Bali.
No, actually in Mexico.
Really?
Yeah.
Nice.
It's originally from India. I selected the stone myself, had it custom made. It's really special to me.
You're so fancy. I thought you stayed in India, but then I had it like designed in Mexico. Like,
No,
I love
I
it.
didn't get the stone in India,
No, I'm
but
joking.
it's from India.
Yeah.
Oh, okay.
I
Cool.
love it.
Thank
I
you.
love it.
Thank you.
So I'm very curious. I really would love to know what was your process like. What did it feel? What did you see or sense or hear?
So usually my processes are quite visual, but this time I was really in the body a lot. And I could just feel the sensation, especially on the right back side of my body, like lots of vibrations. And I've seen the heart, like things coming inside the heart rather than being taken out, and just it becoming really shiny, bright heart. So that was really beautiful. And
Did it feel like energy was coming back to you, like your
Yes,
energy? Very good.
definitely,
Nice.
yes, that was really empowering, really empowering. And also, I felt like my body was shaking, like I'm landing with the aeroplane.
That's the cycle. That cycle's completing.
And also I could feel I'm crying, but I couldn't feel the emotion behind it. Does it make sense? Like it's just
That's beautiful. I'm really glad that you said that, because what that means is that it's a trauma cycle completing. Emotion has shifted, but it's a physical cycle now completing. It's very normal for me to sometimes see a student or a client and they're crying and they're like, I don't know why I'm crying, but I'm crying. What is this? Like the emotion's gone, but that's the body's delayed reaction. And that's normal. It's just a cycle. Okay, perfect. What else?
Yeah. And then I could really sense my mother's and my father's gratefulness for actually doing this.
Yeah.
Because it's important.
Yeah, of course it is. Yeah. Got it. So, how do you feel?
I feel really peaceful, really neutral. Things don't bother me.
Very good.
Just good, yeah.
Very
It's
good.
good. It's good feeling.
And how do you feel when you think back to that old problem we talked about earlier?
Yeah, it's like I don't need it, but it's like there is no need. Like before, when I would think back at wine, I'd be like, oh, I just can't wait to like have a glass of wine after I finish this course. But now when I'm thinking
Need
about
a break
it,
from
it's
your
like
bed.
right. But when I'm thinking about it now, it's like the need is missing. It's like I have a choice if I want to have a glass of wine, but there's no like need for it.
Got it. So now we're going to take it one step extra. This is now the addictions process. And this is a really cool technique that you can also teach to your clients as homework. Every time during your integration process, when you start feeling even just a 1% or thought of the addiction entering your mind, you give them this tool. Okay? So, I would like you now just take a nice deep breath. I would like you to close your eyes. That's it. That's it. I would like you to feel, see, sense, or hear the cigarettes and the alcohol in front of you. I'm just going to bring both of them together because you replace one with the other, right? So I'm just bringing both. And as you're observing this, become aware where inside of your body could there be just a small, small need for it. Or not even need, it could be desire, or it can feel like, oh, I want that. It's like that feeling, right? Where in your body?
The wine automatically came liver.
Got it. It wants it, like you feel it at the liver. Got it.
I feel it at the liver.
Got it. That's perfect. So we take one sensation at a time. So now, when you connect there to that part of your liver, now we're going to have a look, feel, see, or sense again the cigarettes and the alcohol. How does your body react?
It doesn't react.
Very good. And how do you feel emotionally?
That I will never want to smoke again.
Very good.
And then I occasionally will have a glass of red wine.
That's okay, but that's absolutely fine. We'll see how she feels after the full integration of 7 days also takes place. Because ultimately what's important is that whatever the substance is, that you are in control of it and it's not controlling you. Because the moment that there's an addictive behavior and you have a need to fulfill that addictive behavior and you can't, and it ruins your day because you can't fulfill that addictive behavior, you know you're dealing with an addiction.
I feel neutral. Yeah, I feel peaceful.
I feel peaceful. Are you sure you feel neutral?
Yeah.
Oh, is that just
I
from
really
old?
am.
Oh, okay.
Yeah,
okay.
this is just the old thing. This is just
Very good.
old tear clearing up.
I love it.
Yes.
Can I
thank you.
integrate you?
Yes, thank you so much.
How are you?
Really like still.
Nice.